what, in fact, is to be sarcoidosis? Sarcoidosis is a painful disease. Medical science has no cure. Medical science knows of no known cause. The disease strikes mostly African Americans and mostly women. The age group most likely affected is between 20 and 40, and while the disease can show up in any organ, the liver, kidneys, the brain, for example, the lungs are often the most prominent target.
I'm Dr. Rajesh Gupta, and I'm actually a board-certified pulmonologist, critical care, and I do sleep medicine. And one of my passions out there is helping people with sarcoidosis. I actually work at USC, the University of Southern California, and I'm the Assistant Program Director for Internal Medicine. Excited to be here today and talk about sarcoid to everyone. What causes sarcoidosis? Now that is the question, isn't it? Well, the answer is we don't know, and that's why we need the research. That's why we need to talk about it. So when we talk about sarcoid, there's different parts when we talk about the cause, the etiology. Number one, who's susceptible to it? Who gets it? So the answer is genetics. They're trying to find out who is going to be predisposed. Is it a certain race? Is it a certain gender? And that's a big question. And just because we know the genetics behind it, which we don't just yet, are there triggers? What triggers this inflammation happening in the body? So some of those triggers could be the environment, and we don't know exactly what those environmental exposures are. The question is it our occupation? Are we working something that's causing us to rev up that immune system? And more importantly than that, let's talk about the word infections. And there are a couple infections that people with sarcoid know that we're trying to piece together. Certain bacteria, let me throw out the word tuberculosis, certain fungal infections, and even viruses. So it would be nice to kind of narrow it down a little bit. And you know what's a hot topic when we talk about sarcoid? Is it autoimmune? Because quite commonly when we talk about sarcoid, we involve a rheumatologist who deals with many other autoimmune diseases such as rheumatoid arthritis or lupus. And sometimes sarcoid gets clumped into that. You know why? We use the same immunosuppressive medications that we do sometimes with other types of autoimmune diseases. So we need to get to the bottom of this to help more people out. So that is a great opening question. What causes sarcoid?
Sarcoidosis, however, is not contagious nor hereditary. But what is sarcoidosis? The key thing to remember is granulomas. Imagine, if you will, a bunch of grapes. Imagine an invisible microscopic bunch of grapes, whereby each grape is a sack of jelly. Granulomas, an important feature of sarcoidosis, is the unexplained creation, distribution, and concentration of these microscopic bunches of grapes inside the lungs, or the kidneys, liver, or the eyes, or the brain, or even along the skin. To be sarcoidosis is to be afflicted with these massive concentrations of micro grape sacs inside the body.
Away from this video with sarcoidosis is that sarcoidosis is a chronic illness that although we don't have a cure for it, we have a lot of available treatments, number one. Number two, very important, is that many patients do very well having the illness, meaning that either their illness regresses on its own or it does not progress. So that's important to mention. The other thing that's important to mention is that very rarely do people die from sarcoidosis. The death rate is less than 5%, which is very low. The cases where people do die, it's from conditions such as progressive lung scarring. So when the sarcoidosis very aggressively affects the lungs, sometimes can affect the right side of the heart. And sometimes when we do see sarcoidosis rarely affecting the heart, that can make patients very, very sick.
With no known cause and no known cure, to be a person with sarcoidosis means having a new lifestyle of symptom treatment that could even include organ or lung transplant surgery.
My name is Ruth Jacobs, and I'm from the Sarcoidosis Network Foundation that was started from my husband, Earl Jacobs Jr., who is no longer with us, but he was afflicted with sarcoidosis many years ago.
To keep this going, as they say, hope is the thing, is the key, that one day we will find a cure for sarcoidosis.
To be sarcoidosis or not to be? This is an important question for sarcoidosis sufferers. Know and investigate all of your options.